Good evening. I'd like to call to order this June 2nd Buncombe County Board of Commissioners meeting to order. Thanks everyone for joining us. Please join us in the Pledge of Allegiance. Anyone parking for this meeting or using the bus can pick up passes on their way out this evening, and it will be valid for today only. Ethics reminder to the board. In accordance with the Code of Ethics adopted by the board, all county commissioners have a duty to obey all applicable laws regarding official actions, to uphold the integrity and independence of the office, to avoid impropriety in the exercise of official duties, to faithfully perform the duties of the office, and to conduct the affairs of the governing board in an open and public manner. Is there any item on the agenda, the outcome of which will have a direct, substantial, and readily identifiable financial impact for any board member? Does any board member have a financial interest in any public contract coming before this board today? There being none, all board members have a duty and obligation to vote. Commissioners, we will review the consent agenda, and we do have a need for a closed session as soon as we do that. Does anyone from the public or commissioners have any questions about this evening's consent agenda? If not, do we have a motion to approve?
I move that we approve the consent agenda.
Second.
All in favor?
Aye.
Consent agenda approved. We will proceed with the agenda. Mr. Euler.
Yes, I need a motion that the Buncombe County Board of Commissioners go into closed session for the following reason: to establish or to instruct the public body staff or negotiating agents concerning the position to be taken by or on behalf of the public body in negotiating the price or other material terms of a contract or proposed contract for the acquisition of real property by purchase, option, exchange, or lease. The statutory authority is contained in North Carolina General Statute 143-318.11, subsection A5.
Do we have a motion to enter closed session?
So moved. Second.
Great. All in favor? Aye. Any opposed? We are in closed session, and we will return.
Yes, we will return, and you will take action later.
And we will take action later. Thank you for that.
Okay.
All right. You all, we will return briefly. We need Sarah. Appreciate it. We are back from closed session. Thank you for your patience. I appreciate it. Before we move into public comment, as I was walking around, a couple of folks asked what happened to my face. I addressed it at 3 p.m. The camera's on me. I'm going to address it one more time. I just want to say thank you to the Town of Weaverville Fire Department, Reems Creek Fire Department. Weaverville is beautiful. Downtown Weaverville is a great place to visit. Just don't do what I did and don't fall face first onto the pavement. But I will tell you, Weaverville Fire responded swiftly. Reems Creek Fire and paramedics were on site, and Ivan, our telecommunicator, was on the phone immediately, providing excellent medical care. It's such a reminder of why our first responders are there for us in the worst of times, but also the importance of our first responders. And I'm incredibly grateful and appreciate the incredible medical care that I received over the weekend on Saturday. But don't let that deter anyone from visiting the quaint Main Street of Weaverville. We are going to move into public comment. The time limit for individual comment to the board is 3 minutes. Please state your name before you begin speaking. If your time expires, you may leave any question along with your name, address, and phone number with the county manager. Board members are not expected to comment on matters during public comment. This is your time to speak to us. All public comments must be directed to the board as a whole, not to individual commissioners, staff, or audience members. There is no clapping, snapping, or booing allowed. The board reserves the right to deny public address on any subject previously presented to the board during the same meeting. Please note that a group can elect one person to speak for 10 minutes if 8 people in attendance relinquish their right to speak on the issue. Our first person is Casey Miller. Right here, Casey. So sorry. We just assume everyone knows where they're going. Please come to the podium.
Thank you. I appreciate that. And hello, Commissioners. I am Casey Miller. I am the Executive Director for the Council on Aging of Buncombe County. And I'm here with my board chair, Michael Collegero, and our board treasurer, Bob Salmon, and his wife, Connie. And I'm here to thank you for your allocations and for your continued commitment to our older adults in Buncombe County. And I want to humanize a bit of that budget that's up for consideration for adoption. Since 1964, the Council on Aging has been the aging services organization for Buncombe County. And we have been promoting the independence, the dignity, and the well-being of our seniors in partnership with the county and with lots of aging services partners here. And we are very, very proud that we have been good stewards of the funding that you all have provided. And we are grateful to continue to receive funding in the budget today. So 87 cents of every dollar that we receive goes directly to senior services, not to overhead. And I want to provide a little bit of some human stories attached to the funding. So what does that investment look like? The Congregate Dining Home and Community Care Block Grant funding provides over 2,100 meals to seniors across 4 locations in Buncombe County. And this isn't just a meal, a hot meal for a senior who, low-income seniors, seniors that live alone, they can receive that meal free of cost, but it's the community connection. They come in, they eat together, they have formed their dinner clubs, they stick around for Wordle, Zumba even. Sometimes it's the only point that they are not alone in that week is for that meal. So we thank you for your continued investment there. And another investment that is in the budget for adoption is our Information and Options Counseling Grant. This is our resource coordination. This is care management. It's kind of the heart of what the Council on Aging of Buncombe County does for our seniors. So we provide referral services and connect people with community resources that help them with transportation, help them find food for the next week or month, and then help them find resources for minor home repairs that can help them age safely in their homes. So we thank you for these investments, and if and when you all are ready for more investments,
Thank
we
you,
stand ready
Casey.
to partner with you.
Thank you, Casey. We appreciate it. William Baxter. No? Okay. Ken Buckner.
Yes, my name is Ken Buckner. Monday, July 24, 2023, after being sworn in as president of the North Carolina Sheriff's Association, Darrell E. Campbell of Iredell County had these words: "I have always had the utmost respect and admiration for the office of sheriff because of what it stands for and its unique place in history. One of the characteristics which sets the office of the sheriff apart from other law enforcement agencies is its direct accountability to the citizens through the election of the sheriff. It is the stand-alone identity of an independent office in which the sheriff exercises the power that of the public trust. Elected sheriffs are accountable directly to their state's constitution and the United States Constitution, laws, statutes, and the people of the counties, thereby maintaining the very roots of democracy for the people, by the people." What I take from those words by a highly regarded sheriff down there in Iredell County is that liberty and justice for all channels up from citizens through all the entities of government, with one of the most important is the integrity of the members of law enforcement. While there are no perfect circles in any part of society, when officers violate the conditions of their employment, as Quentin Miller's 2 deputies did on October 7, 2024, the award-winning sheriff, Quentin Miller, needs to explain. With unnecessary force by Kelly. You know, then I ask, I've got 2 dismissal sheets at home. Second-degree trespassing and assault on a government employee. Both dismissed, didn't even make it before a judge, they were bogus. And the problem is that one officer jumped on me like a pit bull. First time in my life I'd ever been in a fight, really. And the second officer went to the magistrate's window in the Buncombe County Sheriff's Department and said that I struck him on the right cheek with a clenched fist to cover the whole thing up. Well, you can't have a deputy with a gun and the force and all what they have, the powers they have. He's now a school resource officer at Swananoa Community School. You can't have an officer, and I'm just shocked. I've sent the chairperson here a complete handwritten report that got me my dismissals, along with pictures. You know, I had a medic come up to me down there in Swananoa on October 7th and says, "Do you want to go to the hospital before you go to book it?" It was that bad. She's got the pictures. It was that bad. And still, all I hear out of the internal investigation over there, and I filed a complaint. Circled the wagons, kept the videos they needed to, and I'm really feeling singled out in today's world. I never knew that spending $2,500 on one attorney, which I fired because he wanted to plea bargain it. I said, "What?" I told him, done nothing wrong. I got a second attorney, didn't even make it past the little swinging door. I turned around and had 2 dismissals, said I've done nothing wrong that day. Thanks for your time.
Thank you, Mr.
I'll give you an
Buckner.
update, but I do want you guys, You're the stewards,
Thank you, Mr. Buckner.
county citizens. Thank you for your time.
David Greenson.
Good evening, Commissioners. I'm David Greenson. I'm with the Government Accountability Project of Asheville, or GAP-AVL. First, I want to thank the county for continuing to invest in affordable housing. We support the proposed housing bond on your agenda tonight and appreciate the housing investments included in this year's budget. Our request is simple. We want you to pair those investments with a commitment to anti-displacement analysis. Here's an example that highlights why this is important. Last month, the city of Asheville considered a rezoning request to support the Caribou Road housing proposal within the Shiloh neighborhood. The project was described as affordable housing in units averaging around 60% of area median income, which sounds great. But if you look below the surface, the reality is more complex. Area median income is calculated across 3 counties and can be deeply disconnected from the lived reality of a particular neighborhood. And that's what was happening here. Incomes in Shiloh are substantially lower than that regional median. As a result, many of the new homes would have been unaffordable to people who actually live in that neighborhood and would have brought new people in to move into that neighborhood and displace the people that were already living there. Residents worried that rising property values and rents could put additional pressure on people who were already at risk of being priced out. So the question really needs to be not simply whether a project is affordable, the question is affordable for whom? Shiloh residents were organized. They attended meetings, they analyzed the proposal, they spoke up for themselves. Ultimately, City Council voted that project down, but not every community has that capacity to organize. And that's why we believe government itself should have the tools to ask these questions. Who currently lives in this neighborhood? Who benefits from this investment? How might it affect residents who are already vulnerable to displacement? And the good news is this data already exists. What's missing is a commitment to gather it, analyze it, and put it in front of decision makers like yourselves before major decisions are made. The city of Asheville is currently investing in the development of an anti-displacement analysis tool in partnership with many community organizations such as ours. Buncombe County was invited to participate in that effort and chose not to. And we just believe that was a missed opportunity, and it's not too late for the county to change its mind and join us. The housing bond, again, a positive step. Housing investments in the budget, positive step. But those investments will be most effective when they're paired with a consistent process for understanding who is vulnerable to displacement, where those pressures are occurring, and whether public investments are helping existing residents remain in their homes and communities or not. Thank you.
Thank you. Steve Sin, and I apologize if I'm misreading handwriting. You can correct me when you come to the podium.
Thank you, Commissioners. My name is Steve Sen, and I used to own Live Edge Wood in Swannanoa. It was next door to Carpet City. I'm here to represent a total of 5 businesses in Swannanoa that want to come back, and we're here in support of the adoption of the anti-displacement rulings. That would be crucial and critical now. We need help now. If we'd already had that, we'd be ahead of the game. But as it is, we're lagging behind. There are rules that are hurting us. We'd like to be able to think that if the county would at first not do any harm. I've lost my business. My means to support myself. I'm retired. I was still working. My property tax doubled this year. It went from $316 to $465 on less than 2 acres of land. And we would like to see that maybe the commission and the council or whatever could waive some of the property taxes for a time after a displacement like we're going through now. We have up to, like I say, there's five businesses that we want to bring back. These people all lost their businesses. We're showing up every day for all of our friends and the people that we work with and trying to trying to get us back. We want to live in Swananoa. We don't want to be displaced. I don't want to go anywhere else. This is my home, and we're all dedicated to that, and we would like to find some way to proactively, if you have somebody that a person that we could contact and talk with, come out and see the places, see what we're up against and what's going on, help us out. I think it would be very important for boots on the ground from your offices. But we want to get back, we want to get happening. We want our town back. We'd love to build it back. I want to thank Commissioner Horton. She has been amazing, has been there countless times to come speak and sit with us, and we definitely appreciate and love her efforts. So, but I'll stop there before I stumble around any worse. But thank you all for hearing us out.
Thank you, Steve. Emily Bengo.
Hi, my name is Emily Bengo, and first I want to state that I support the housing bond and appreciate the county's commitment to investing in affordable housing. And at the same time, I want to encourage the county to develop a formal anti-displacement strategy so that future housing investments are guided by data about where displacement is occurring and who is most at risk. Housing stability for residents of all income levels is critical to community health and economic mobility and public safety. A developer that promises housing at a percentage of AMI is simply not enough to keep folks in their homes. I have personally seen and felt the impacts of displacement of community members and friends over the past few years. People I care about who had built lives here, who worked here, and invested in the community have been forced to move because of rising costs and unaffordable and limited housing options. The storm only exacerbated these issues, and while we are all feeling the impact, I feel concerned about the lack of strategy the county has communicated around ensuring that long-term residents can afford to remain here. Thank you.
Thank you, Emily. Is there anyone else who would like to speak but did not sign up? Oh.
I just wanted to say, Pepe Acebo, Asheville City Schools Board of Education, thank you to the commissioners and to the county staff and for your ongoing support of public education and early childhood education. It means a whole lot to know that our county commissioners believe in the work that our schools are doing and the important role that our schools play in our community. Thank you.
Thank you. Yes, go ahead. Come on up. And just state your name when you come to the podium, please.
Hi, my name is Kesslyn Tench. I am here to support you developing and building and using an anti-displacement analysis tool. I use glasses to see better, okay? A lot of us use glasses. They're a tool. They help us to see details, and they help us with a long-term, long-range vision, okay? This is what glasses do. They help us to see better. This anti-displacement tool can help you see better. It can help you to look at decisions that you're making and figure out how that's affecting people. It will help you do things that help all of the people of the county, because nobody wants people to move away because they've gone bankrupt, or they've lost their business, or they've lost their house, or they've had foreclosure. No one wants that in the county. That's not good for anyone here. So if you're doing things that are best for the county, then you need to have a vision, you need to have a tool to do that. I used to live in Alaska. I was in Alaska for 15 years. 10 of those 15 years, I was on the planning commission in my county. 8 of those, I was the presiding officer of the commission. So I understand trying to make decisions and not really knowing how these decisions are going to affect real people. If you had this anti-displacement analysis tool, then you could make those decisions better. You would have something to ask certain questions, to say, what about this? Have we thought of this? Have we thought of this? Another thing it can do is not just help you, it can help your staff. It can help county staff as they're making decisions every day. This can be a framework for them to look at. And there's always some leeway in permit decisions, in all kinds of decisions that the staff makes every single day. And this framework could help those staff members make those decisions and do a little bit of, there's leeway that they could give if people are really affected by foreclosure or bankruptcy that's imminent. So I really encourage you to adopt something like that. Thank you.
Thank you. Is there anyone else who would like to speak? I think we have one more joining us.
Hello. How are you?
Very well. Thank you. Please state your name before you begin speaking.
My name's Browning Jeremiah. 3 words. TAQIYYA KAFIR. Striking next. It was education for me on multiple levels. You're not shooting this messenger. I'll let everybody look it up and look at it for themselves. They have minds and brains of their own. Good luck.
Thank you. Is there anyone else who would like to speak? All right, thank you all. We appreciate it. Avril, do you have a manager's report tonight? Okay, thank you. All right, we'll move into our presentations, and our first is a proclamation for Dr. Suzanne Landis Day. Karen Wallace-Meigs is here to accept the proclamation presented by Vice Chair Moore.
All right. Project Access, Dr. Suzanne Landis Day, June 11th, 2026. Whereas the Buncombe County Medical Society was founded in 1885 and was renamed the Western Carolina Medical Society, WCMS, in 2011. And whereas WCMS has been an innovator in supporting and advocating for caregivers in the practice of medicine and working collaboratively with area organizations to address the health challenges facing our community's residents. And whereas Suzanne Elizabeth Landis, MD, MPH, spent her lengthy and acclaimed career caring for the residents of Western North Carolina as a practicing physician. And whereas Dr. Landis has served in the faculty at the University of North Carolina School of Medicine, director of the Center for Healthy Aging at Mountain Area Health Education Cooperative, MAHEC, a National Health Service Corps physician, a Robert Wood Johnson Clinical Scholar, a Center for Medicare and Medicaid Services Innovation Advisor, and a Hartford practice change leader. And whereas, in 1996, in response to the growing number of uninsured residents of Buncombe County, Dr. Landis spearheaded the creation of Project Access. And Whereas, since its establishment, Project Access has been a vital healthcare initiative connecting tens of thousands of uninsured, low-income residents in Buncombe and Madison counties who are ineligible for Medicaid with free, comprehensive medical care of more than $100 million in value. Whereas, Project Access is a model program duplicated 200 times in municipalities and regions across the nation. Whereas, Dr. Susan Landis is and shall forever be the guiding spirit of Project Access. And whereas Project Access is celebrating 30 years of moving medical mountains for residents of Buncombe County, now therefore be it resolved that the Buncombe County Board of Commissioners proclaims June 11, 2026 as Project Access Dr. Susan Landis Day in Buncombe County and encourages other community agencies, healthcare practices and providers, hospitals, and residents to recognize the historic value and potential of this healthcare resource and its founder, this, the second day of June 2026. Signed, Amanda Edwards, Chair, Buncombe County Board of Commissioners. Thank you so much.
Thank you. Thank you, Commissioners. This means so much to us. Next week, we will celebrate the 30th anniversary of Project Access. Last year, we coordinated $9 million in free care for the people of this county and Madison County as well. We are so grateful to you for your past support. We are so proud of what Dr. Landis started, and she could have had no clue 30 years ago it would be needed now more than ever. We served 1,200 residents last year, and we have, as the proclamation read, it has been tens of thousands over the years. Thank you so much for your support. This is a surprise, so if she's watching, Dr. Landis, if not, she'll be really surprised next week. Thank you so much. Thank you.
Next, we have our Gun Violence Prevention and Awareness Month proclamation. Regina Herring, Hannah Ledgerton, and Will Baxter, along with community partners Keenan Lake, Jackie Latek, and Libby Kiles, are present to accept the proclamation presented by me this evening. Gun Violence Prevention and Awareness Month, June 2026. Whereas, according to 2024 data from the Pew Research Center, 44,447 people died from firearm-related injuries in the United States. 62% of these were suicides and 38% were homicides, totaling approximately 15,364 deaths. And whereas this loss of life equates to approximately 122 firearm-related deaths every day in the United States. According to the 2024 FBI data, 85.2% of homicides in the United States involved a firearm, and this rate remains approximately 25 times higher than that of other high-income nations. And whereas firearms have been the leading cause of death for American children and teens ages 1 to 19 since 2020, exceeding motor vehicle crashes, cancer, and all other causes, with no other peer nation having firearm deaths among the top causes of child mortality. And whereas in 2025, the Buncombe County Register of Deeds recorded 56 death certificates that showed someone died by a gun, 48 of those incidents occurred in Buncombe County, with the youngest only 14 years old, while the oldest was 93 years old. And whereas Buncombe County is working to end death by guns, including suicides, accidents, and gun violence, with evidence-based solutions. And whereas the support for Second Amendment rights of law-abiding residents go hand in hand with promoting gun ownership safety and keeping guns away from people with dangerous histories, gun owners in North Carolina have a responsibility to safely store their firearms to help prevent accidents and theft. And whereas since 2021, Buncombe County's Justice Services Department has partnered with community-based organizations to develop community safety initiatives directed toward healing, support, practical resources, and a reduction in violence for our communities with the highest rates of gun violence, and continues to partner with these organizations to implement a community-based public health response to violence, offering training and support for community health worker violence prevention professionals, youth leadership development, and convening a multi-sectoral coalition to prevent and respond to community violence. And whereas Buncombe County's Health and Human Services Department seeks to strengthen our community by advancing health, safety, and opportunity, including preventing injury and death by promoting health and well-being through the use of data, research, policies, and partnerships. Now therefore be it resolved that the Buncombe County Board of Commissioners proclaim June 1 through 7, 2026 as North Carolina's Safe Week of Action and June as Gun Violence Prevention and Awareness Month in Buncombe County. We urge residents to recognize survivors of gun violence, honor the lives lost to gun violence, commit to reducing gun violence, and encourage gun owners to commit safely to storing their guns using approved measures. Signed by Amanda Edwards on this second day of June 2026. As a gun violence survivor, it is truly an honor to present this to you all and to work alongside each of you in reducing gun deaths and violence in our community. Thanks for the work that you all do.
Good evening, Commissioners and Chair. Just want to say thank you and just indicate that we remain committed, Justice Services in Buncombe County, to ending gun violence, working with our community partners. And I think we have Keenan Lake with KL Training Solutions and Jackie Latak with Spark, and we want to recognize you two because they've been key partners in this work, and we will continue to work because it is an initiative that for Buncombe County that's been in place for several years now, that we want to make sure that we are reducing violence in our community. And Orange is June's Gun Violence Prevention and Awareness Month, so wear your orange. On Thursday at about noon, we're going to be meeting in packs, so bring your orange. We're going to take a big photo, so we invite you all to come out. You want to?
Hannah Ledgerton, Youth and Family Justice Manager with Buncombe County. It is my honor to have worked alongside our community partners who have championed implementing a community-based public health response to violence these past years. As Regina named, we have Keenan Lake with KL Training Solutions, Jackie Latek with the Spark Foundation, and although she couldn't be here with us tonight, Libby Kiles from the Youth Transformed for Life. I'm also grateful to recognize the leadership and commitment of our Buncombe County Chief Court Counselor, Sylvia Clement, and thank you so much for all of your partnership in this work. Thank you to all of you for your dedication to creating safer, healthier, and more connected communities with opportunities for youth, families, and community members to grow and thrive. And now Keenan will share a few words on the importance of this work.
Good evening. First of all, I would like to say thank you for the commitment that the county made for this partnership, this type of work to happen. Been around the county for a very long time, and this was some of the most impactful work that we've seen, truly investing back into the community, to work in community, to alleviate and try to eradicate gun violence. But at this time, I also want to personally thank Hannah Ledgerton and Will Baxter. The work that they did, the work that they allowed us to do, the partnership, the leadership that they provided allowed our organizations to really, really flourish. And I think, if I'm not mistaken, the numbers of violence have been down over the last few years. And so, again, I want to thank the team. I want to thank Jackie Latek, Libby Kiles for the partnership. And I look forward to seeing more stuff like this done with the county. Again, hats off to you guys for allowing this thing to happen, investing back in our community, and allowing these numbers to happen. So again, thank you.
Dr. Ellis Matheson is on her way up to provide the Child Fatality Review Annual Report. Good evening, Dr. Matheson.
Thank you. All right. Good afternoon, Commissioners. I'm coming today to you as Chair of the Buncombe County Child Fatality Review Team. I will be covering points from the team's 2025 annual report to the board. So first, want to start with a little bit of background. Our local Community Child Fatality Review Team is part of a statewide child fatality prevention system. Session Law of 2023-134, the Appropriation Act of 2023, included revisions to the Article 14 and other parts of the state statute to restructure the state's child fatality prevention system. The restructuring began at the state level in 2024, and changes to the county level teams began July 1st of 2025. Per North Carolina general statute, the purpose of the state's child fatality prevention system is to assess the records of deaths of children from birth to 18 who are North Carolina residents at the time of their deaths. And with respect to these cases, to study data and prevention strategies related to child abuse, neglect, and death, and to utilize multidisciplinary teams to review these deaths in order to do the following: develop a community-wide approach to problem of child abuse and neglect, understand the causes and contributing factors to childhood deaths, identify any gaps or deficiencies that may exist in the delivery of services to children and their families by public agencies that are designed to prevent future child abuse, neglect, and death, identify and aid in facilitating the implementation of evidence-driven strategies to prevent child death and promote child well-being. And finally, to make and implement recommendations for changes to laws, rules, and policies that will support the safe and healthy development of children and prevent future child abuse, neglect, and death. So your role in the child fatality prevention system as the Board of Commissioners is to receive the annual report from the Child Fatality Review Team, to advocate for system improvements and needed resources, and to appoint members to the Child Fatality Review Team as designated by state statute. So now I'm going to share some data from the team's review of 2024 child deaths. It is important to remember that while this is the 2025 annual report, this data is from 2024. So this slide is showing the number of child fatalities by cause of death in 2024. There were 14 fatalities in total, including 5 infants. The fatalities due to accidents involved an accidental poisoning with illicit substances and a drowning due to flooding following Tropical Storm Helene. The fatalities due to perinatal conditions involved extremely premature births, and both sudden unexplained infant deaths were categorized as having an undetermined cause, but did involve unsafe sleep environments and co-sleeping. This slide is looking at fatalities by age. Here you can see the age of death is spread between the ages of 7 to 17, while we do still see the majority of deaths in infants. In this next slide, we're going to look at the cause of death for those infants. And here you'll see 1 death from birth defects, 2 deaths from perinatal conditions, and the 2 deaths from sudden unexplained infant death. In the past years, the Child Fatality Review Team has made specific recommendations related to safe sleep in the annual report. From this data, we can see that it is still a continued need, even though you will not see it as a specific recommendation from the team in this annual report. The state does continue to focus on safe sleep with a statewide campaign with materials that are used here in Buncombe County. This slide is looking at the child fatalities by race and ethnicity. When looking at all of the fatalities, there were 6 white non-Hispanic, 5 black non-Hispanic, 1 white Hispanic, 1 Pacific Islander non-Hispanic, and 1 Asian non-Hispanic. And if we look specifically at the infant fatalities, we have 2 white non-Hispanic, 1 black non-Hispanic, 1 white Hispanic, and 1 Pacific Islander non-Hispanic. So with regards to racial disparities in infant mortality, Buncombe County Public Health has followed the infant mortality disparity ratio between black and white babies as part of our community health improvement work for many years. The state also follows this data point, and the new data, including 2024, was released May 1st of this year. So for the period of 2020 through 2024, they look at the 5 years, the infant mortality disparity ratio in North Carolina stayed the same at 2.7. During that same 5-year period, Buncombe County had an increase infant mortality ratio from 2.96 to 3.64. So of course, a disparity ratio of any size is not what we want. And of course, one that is worsening is certainly not acceptable. So efforts focused on Black infant and maternal health, social determinants of health, and racism need to continue to be prioritized. So next, we are going to look at the specific recommendations made by the team in 2 different areas. The first recommendation area is around drowning, which those recommendations include development of a more robust emergency and evacuation notification systems that are accurate, regularly updated, and inclusive of all communities, and to increase awareness in all communities about emergency preparedness and available resources. As we heard earlier, drowning is classified as an accident. We do know that 1 youth and other adult drownings occurred related to following Tropical Storm Helene in 2024. This team also did review youth drownings. In 2022, there were 2, and in 2023, there was 1, which were unrelated to weather events. So we do know that drownings do occur in absence of hurricanes, tropical storms, or flooding. So all this together demonstrates why water safety, including education around flooding, is important. Next, the team made recommendations around youth suicide. This slide is looking at trends in youth suicide in Buncombe County over the last several years. As shared in the report last year, in 2022, there was a significant increase in youth suicide that continued into 2023. Thankfully, you can see that it does appear to be decreasing. The suicide deaths over the last 7 years have been in children ranging from ages of 12 to 17, and the most common method has been hanging. The team's recommendations around suicide include the need for parent support groups for families of children who have behavioral health care needs, especially for families with children who have had psychiatric hospitalization or who are involved in enhanced outpatient mental health programs, the need for more residential treatment facilities across North Carolina for children with behavioral health care needs, and the need for more established and operational intensive outpatient programs locally and across North Carolina. So to close out, I want to return to your role in the child fatality prevention system, which includes advocacy. We appreciate your support of our efforts and your attention to our recommendations for the prevention of child abuse, neglect, and death. I want to thank the members of our Buncombe County Child Fatality Review Team for their efforts and time, and once again to thank the members of the Board of County Commissioners for this opportunity to share the work of the Buncombe County Child Fatality Review Team. And of course, please feel free to contact me should you have any questions about this report.
Thank you, Dr. Matheson. Other questions? All right. We appreciate your work. This is a tough, go ahead, Commissioner Horton.
I was just going to ask, what can we do as a county commission to help with these numbers? Because they're increasing. In 2023, if my research is right, it was 2.96. And then for this range, it looks like they're always 4-year ranges. Is that correct?
Yeah, it's a 5-year range.
5-year, gotcha. So this year it was 3.64, so we're seeing it. So what can we be, I'm thinking mental health resources, but.
So within the report that you've received, these are specific recommendations made by the Child Fatality Review Team. And that team would encourage you to take those recommendations and then in your work outside as a county commissioner, wherever you can advocate for those resources, whether it be on a local level, a state level, the team would really appreciate that advocacy.
You can definitely do that. I've been saying mental health from day one. Thank you so much, Dr. Matheson, for all that you do.
Thank you, Dr. Matheson. All right, we move into old business. John Hudson, our budget director, is here to provide background information before we approve the FY27 budget.
Good evening, Commissioners. Before we begin, I will ask our County Attorney Kurt Euler to discuss General Statute 14234.3.
Commissioners, North Carolina General Statute 14243 is a relatively new statute, but basically, in essence, it makes it a misdemeanor offense for a commissioner to vote on awarding funds to a nonprofit that they either are a board member of or an executive director of. So before we begin to vote on specific, and I know that all of you as active members of the community may be a member of a board, so we've went and we've gathered what boards you are on and whether we are funding any of those boards. And if so, we would need to do a conflict, not so much a waiver, but basically to excuse you from voting on an appropriation that would affect your nonprofit. So I believe that we've prepared a motion. I'm not sure if you want to do that right now or before they get into voting on the budget.
Maybe near the end.
Okay, so we will do that near the end of John's presentation, but essentially this is to make sure that you are not voting on a appropriation for a nonprofit that you serve on or are a board member of. So thank you.
Thank you, Kurt. Last November, we met with you for a retreat to discuss considerations for our fiscal year 2027 budget planning process. As we move forward, we discussed some of the items that would be considered in budget planning. These included code enforcement for problematic sites, planning for the purchase and subsequent planning of Deaverview Mountain, countywide security, vehicle replacement, investing in professional development, and expectation in increased spending on our debt service. We discussed our community investments, some of the impacts of federal funding in light of government shutdown and H.R. 1, and the plan for creating a single fire taxing district. In January, we returned for an in-depth discussion on capital projects. You received updates on existing projects, and we discussed the 7-year capital improvement plan on county infrastructure with around $375 million in future year projects. We talked about how to pay for capital to include debt financing and general obligation bonds, as county infrastructure and capital needs lack a dedicated funding source, such as the sales tax carve-outs for school capital and AB Tech. We also introduced the concept of a debt service fund. We returned in March for our first budget work session and presented the fiscal year 2027 first pass budget in progress and the current landscape that reflected record inflation driving costs across the board. Department requests have been reduced by $8.6 million, with 37 position requests in the budget, down from the 87 submitted. We discussed personnel drivers and expense to include rising health insurance costs, COLA, and increased costs of state retirement. We also brought forward a decision regarding the Asheville-Buncombe Air Quality Agency and presented an option for it to become a county department. Vehicle requests reviewed by our fleet manager and capital requests reviewed by the internal capital review team and county management were brought forward as well for board review. On April 16th, we held our second work session, focused on revenues. With the property reappraisal, we calculate a revenue-neutral tax rate of 39.22 cents per $100 of assessed value. As we discussed other revenues, we talked about the loss of intergovernmental revenues and how, absent property tax, other revenues were down $4 million from the prior year. This second pass budget also reduced expenditures by $17.4 million and down to 32 position requests from 37. We discussed education funding through our new funding formula that increased the K-12 allocation by $11 million and invited education partners to speak on budget requests. Near the end of April, we held our last work session. We added $5.5 million more revenue and made $2 million more of reductions and discussed a tax rate of 43.54 cents, 4.32 cents above revenue neutral per $100 of assessed value to balance the budget. We also presented a two-year financial outlook that presented a scenario of a tax rate of 44.18 cents, 4.96 cents above revenue neutral to maintain a minimum percent of fund balance per policy and potentially maintain a tax rate until the 2029 reappraisal. On May 5th, the county manager presented her recommended fiscal year 2027 budget at $485.1 million with 32 new positions. This budget recommended a tax rate of 43.52 cents per $100 of assessed value, 4.3 cents above revenue neutral, and used a $1.9 million of appropriation of fund balance for one-time pay as PAYGO capital and vehicles for permits and inspections. This budget addressed the issues discussed in your November retreat planning session, restored community investments to pre-disaster levels, as well as to support strategic plan initiatives. A public hearing was held on May 19th for the budget, and that 7-month planning process brings us to budget adoption this evening. This budget is now $484.4 million, has reduced the number of new positions from 32 to 28, has reduced the recommended tax rate from 43.52 to 43.20 cents per $100 of assessed value, 3.98 cents above revenue neutral, and appropriates an additional $745,000 of fund balance. I will speak to these details over the next several slides. There have been some changes since the manager's recommended budget last month. The reduction of the tax rate by 0.32 cents reduces revenue by $2.5 million. As the fiscal year comes to a close, our tax collector is comfortable moving the collection rate for next year from 99.25% to 99.5%. This increases the remaining ad val revenue by about $840,000. We will increase the appropriation of fund balance by $745,000 to pay for one-time information technology expenses. With receipt of the new indirect cost plan, we will receive an additional $135,000 in revenue from other funds. Recalculation of tax collection agreements yields an additional $85,000 in revenue. On the expenditure side, we have removed 4 requested positions, the associated operating expenses, and staggered some starting dates. These changes allow for a reduction of the recommended property tax rate to 43.20 cents per $100 of assessed value, a reduction of 0.32 cents to 3.98 cents above revenue neutral. The fiscal year '27 general fund budget is now $484,390,465. The property tax rate for 2027 will be 43.20 cents per $100 of appraised value. This will result in an annual increase of $177.71 on a home valued at $446,500, or $14.81 a month. With this tax rate change, revenues are now budgeted at $481.8 million, with property tax the largest revenue source at 70%, followed by intergovernmental revenue and sales tax, each at 10%. These three revenue sources make up 90% of the general fund revenues for fiscal year '27. A $2.6 million appropriation of fund balance added to the revenue equals the $484.4 million needed to balance the budget. Education remains the largest expenditure by function in the general fund at 28%. Public safety makes up 22%, and human services 21% of the general fund. Debt payments increased from 4% to 6% of the general fund budget this year. This budget recommends a cost of living adjustment for county employees consistent with the calculation of the personnel ordinance of the 2-year average of the Consumer Price Index, calculated at 2.71%. It also recommends reclassification of 2 vacancies. This budget adds 28 new positions at a cost of $2.7 million and incorporates 6 positions from the Air Quality Agency as it becomes a county department, increasing headcount in the general fund by 34 positions. This is a 5-year look back at K-12 education funding for local current expense for the 2 school systems. This year, a funding formula was agreed upon by the board and the 2 boards of education, yielding $11 million in additional funding. The Asheville City Schools supplemental tax rate is now proposed at 8.64 cents per $100 of assessed value. This generates roughly $1.3 million of increased revenue over the current year, totaling around $17.8 million. This results in a total increase to education partners by $11.3 million. AB Tech also receives an increase in funding by the unrestricted revenue growth rate from $8.4 million to $8.7 million. The new funding formula results in approximately $4,398 in local funding per pupil in K-12 public schools. As discussed previously, Asheville City Schools is estimated to receive an additional $17.8 million via their supplemental taxing district, consisting of $12.3 million in property tax and $4.2 million sales tax, which increases the per pupil local funding to $8,478 for students in that district, almost double of that of BCS per pupil spending. This budget provides $11.7 million for discretionary community investments. The board approved spending for JCPC pass-through funding earlier this evening on the consent agenda. 11 capital projects are recommended to be debt funded at a total of $38.3 million. Now, these projects will have a financial impact on the general fund in fiscal year '27 and will only be reflected in debt payments once we have gone out to debt and future issuance for those projects as they begin work. 6 PAYGO projects are recommended at a total of $1.6 million and will be funded by a one-time appropriation of fund balance and savings from prior closed projects. Additional fund balance will be used for one-time IT expenses and permits vehicles. $61 vehicles are recommended along with 3 remounts of ambulances. These will be debt funded with the exception of leased vehicles for the Health and Human Services pool and permits and inspections vehicles, which will use restricted permits revenue fund balance. We have added 2 fee waivers to the fee schedule since it was brought with the recommended budget. One to continue the Reduce to Rebuild program, and a second for commercial uses of parks. You heard from our Human Resources Director, Shauna Shepard, on the classification and compensation plan this afternoon at briefing. The plan is effective July 1st, adjusts salary grades to accommodate the 2.71% inflation growth percentage, and adds new classifications. This plan will be adopted with the budget ordinance. Regarding the taxing districts, this budget proposes increases for both districts from the manager's recommended budget. The Asheville City Schools supplemental tax is now proposed at 8.64 cents per $100 of assessed value. The consolidated fire taxing district is now proposed at 11.96 cents per $100 of assessed value. The total of all annual funds, including air quality, is $698,120,717. We discussed the changes to the general fund already. There are two changes to two other funds. The changes in the district tax rates have necessitated changes to the expenditures and revenues in that fund. Additionally, a revised state funding for the 911 Special Revenue Fund has been received, as resulted in an $18,400 reduction to the budget in that fund. As discussed at the briefing earlier this afternoon, the School Capital Commission met last month and recommended 3 projects for pay-go funding for Asheville City Schools using $2.1 million of sales tax revenue and a debt-funded project for Buncombe County Schools at $28 million. 2 projects are recommended for funding through Article 46 sales tax funding for AB Tech for a total of $13,125,000. These projects will be approved with the adoption of the capital projects ordinance. We discussed Senate Bill 889 last time, which would push out the property appraisal next year if passed. We are monitoring this closely, and while this bill was passed by the Senate on May 7th, it has been in committee in the House since May 11th with no action. If this bill passes, this would require the board to take action in the new fiscal year with a revised tax rate. There are 2 budget ordinances requiring adoption. The first is the annual funds ordinance, which establishes the annual budget for all annual funds as well and includes the adoption of the fiscal year 2027 fee schedule, school community impact projects, the Health and Human Services billing guide, and the position classification and compensation plan. These documents are posted with the agenda. The second ordinance is the capital projects funds ordinance. This makes updates to the multi-year funds to align with any appropriations from the annual funds and to establish recommended capital projects and grant projects. This includes approval and adoption of the recommended school capital fund and AB Tech fund projects. Per the MOA with the state, there is a resolution for budgeting strategies in the opioid settlement fund. The requested action from the board is to approve the 2 ordinances and the resolution. Are there any questions?
John, commissioners? Questions, comments?
Do you want us to go ahead and make a motion first and then share comments for that after we make a motion?
I'm going to turn to Kurt because we do need
Are
to do the
you wanting to
motions.
do the so the conflict motions would be that you would start adopting some of the individual things in the budget based on the conflict. So you can do that now if you'd like, assuming that none of those would be changed in the motion.
Would it be easier for me to go ahead and make a motion to adopt the budget ordinances and resolution, and then
I don't know if we want to have 2 motions pending at the same time, so I would first do the conflict of interest and then approve the appropriation in the budget separately, then make a large motion to approve the budget as written.
Okay.
Okay.
Let me start with the conflict of motions.
Yes.
I have. In accordance with North Carolina General Statute 14234.3, I move to recuse Chair Edwards from voting on the Economic Development Coalition appropriation in the FY27 budget due to the conflict of interest of being a board member of the EDC.
Second.
Right. Sloan or Moore was a tie. All in favor of recusing me from the EDC vote, say aye.
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 Any opposed? All right, motion carries.
Okay. I move to approve the EDC appropriation as set forth in the 2027 budget.
Hold on just a moment, Commissioner Wells.
Oh, so I just want you, Commissioner, Chair Edwards, you don't vote on this one?
That's right.
Okay.
All right, sorry, Commissioner Wells.
I move to approve the EDC appropriation as set forth in the 2027 budget.
All in favor?
Aye.
Any opposed? All right, motion carries.
Next is the conflict motion for Pisgah Legal Services. In accordance with North Carolina General Statute 14234.3, I move to recuse Commissioner Moore from voting on the Pisgah Legal Services appropriation in the FY27 budget due to the conflict of interest of being a board member of Open Doors of Asheville.
I actually think that needs to be, that was a typo on my part. It should be Pisgah Legal Services.
Oh,
I
board member
apologize.
of Pisgah Legal Services.
Do we have a second?
Second.
All in favor, say aye.
Aye.
Any opposed? Motion carries.
I move to approve the Pisgah Legal Services appropriation as set forth in the 2027 budget.
Second.
All in favor, say aye.
Aye.
Any opposed? All right, motion carries.
Okay, now the conflict motion for Arts Asheville. In accordance with North Carolina General Statute 14234.3, I move to recuse Commissioner Moore from voting on the Arts Asheville appropriation in the FY27 budget due to the conflict of interest of being a board member of Arts Asheville.
Do we have a second? Thank you, Commissioner Horton. All in favor?
Aye.
Any opposed? Motion carries.
I move to approve the Arts Asheville appropriation as set forth in the 2027 budget.
Second.
Second.
All in favor, say aye.
Aye.
Any opposed? Motion carries.
Conflict motion via health. In accordance with North Carolina General Statute 14234.3, I move to recuse Commissioner Sloan from voting on the via health appropriation in the FY27 budget due to the conflict of being a board member of via health.
Do we have a second?
Second.
All in favor, say aye.
Aye.
Any opposed? Motion carries.
Move to approve the via health appropriation as set forth in the 2027 budget.
Second.
Thank you. All in favor, say aye.
Aye.
Any opposed? Motion carries.
That is all I have.
Thank you, Commissioner Wells. We appreciate it.
Thank you.
Madam Chair, do you mind?
Yes, yes, go ahead, Commissioner Moore.
Just for my edification, Kurt, and make sure we're staying P's and Q's on legal, for boards such as AB Tech Joint Capital Advisory, is that something that we'd have to disclose, or just wanted to make sure we're clear on that?
No, there are some appropriations that aren't direct appropriations or maybe dues or memberships that the commission pays for. I don't think that the statute really covers those quasi-governmental agencies. So I believe that there is no violation, and if anyone accuses that there's a valid legal defense. We mostly are trying direct appropriations, or where groups are getting out of a larger grant, they may be getting a portion of that grant. And I believe we've covered those today.
Thank you.
All right. Further questions or a motion?
I'm going to piggyback off of Commissioner Moore and the COC. We spoke about it earlier. I'm a non-voting member on the board. I'm good to go?
Yes, I believe that you are, and that you would not have a conflict of interest in voting on any appropriation for that, because you are there as more of an ex officio member as a part to that. So yes, you're okay.
And I work for a company that receives Medicaid funding.
That's completely separate. That
Okay, 'cause I am
you're not voting to give yourself money or the company that you work for money or anything like that. That's where the conflict would appear, and it's not apparent in this case.
Thank you so much.
Are there other questions? Go ahead, Commissioner Wells.
Motion to adopt the budget ordinances and resolution.
A second.
All in favor? Or Discussion, please. Thank you. Comments or discussion? Thank you.
I'll share some. First of all, thanks, as John mentioned, 7 months is a long time to be working on the budget, and so thanks to staff and to my fellow commissioners for all that effort over that time, and definitely to staff for answering all our questions throughout the process. And one thing I've noticed, I want to address there's still some misinformation out there when I'm out in the community and hearing from people and we're receiving emails. There's still some misinformation that I want to address part of that because I think it's important. And I think some of this stems from the reappraisal this year is maybe why there's more of this misinformation, it seems like, this year than other years. And so with that, just bear with me a little bit while I share some thoughts on this. So we were scheduled for our reappraisal. I know everybody in this room knows this, but this is for others in the community as well. I just want to reiterate this, because I know that staff says it over and over, and then I still realize no matter how many times y'all say it in our budget meetings, there's just still this misinformation. So we were scheduled for our reappraisal in 2025, and we put it off due to Helene. And we're legally required by the North Carolina Department of Revenue to conduct it this year. Reappraisals are about getting all property assessed accurately and fairly, and that is what we aim for, and also why we have an appeals process. And with this reappraisal, the total property base grew around 43%, and this is a 43% growth from the last reappraisal, which was 5 years ago. And this is in line with what we're seeing with the growth that we're seeing across the state. And this percent only represents the growth in the property-based values. It doesn't represent growth in our budget, nor does it represent growth in individual property taxes owed by individuals. If we had left the tax rate at last year's rate, then we would basically have realized that 43% of growth, but we are not doing that, nor were we ever doing that. That was never part of the discussion. We start at revenue neutral, and revenue neutral is based on last year's property revenue. And when we think back to last year, we know our community lost so much, including significant amounts of property. We had more than $600 million in property value loss here in Buncombe County alone. And we made hard decisions last year during the budget process due to Helene to reduce our budget by millions, cutting programs and limiting operations, including no new positions. And last year, our general fund adopted budget was $10 million less than the previous year's budget. So I just wanted that context because that is the starting point of where we were. So, and I stand by those difficult decisions that we made last year. And it is now time to begin to rebuild our budget. We have increased our fund balance above the 17%, and it's projected to be around 19% by the end of this fiscal year. And the recommended budget is structurally sound and maintains a 17% fund balance, which exceeds our 15% policy. And the reality is, we know there are decisions being made at the federal and the state level that are impacting us all. And the lack of stability and certainty at federal and state levels is troubling. It impacts us all on individual levels, and most definitely impacts us on a county budget and service level, because we are mandated to provide services, but they continue to cut our funding to provide those services, as well as not providing adequate funding to support our public schools. Our costs continue to increase each year due to the choices being made at federal and state levels. And it is our job to be responsible and to balance the needs of our community. This budget invests in our people and in our recovery, as we ensure that we are responsibly planning for the future, and it has an increase of about 10% over last year, and it restores funding that we cut from last year, and it invests in our recovery. We are restoring funding and investing $11 million in community priorities that align with our strategic plan, with the critical needs of early childhood education, affordable housing, and behavioral health receiving more than $8 million of that funding. We are investing an additional $11 million in our public schools. In order to provide essential services, we are restoring training budgets, providing a cost of living increase, and paying increasing insurance costs at approximately $10 million. And we are investing in affordable housing, parks, libraries, land conservation, EMS facilities, and vehicles for an additional $8 million in debt. We are investing in home repairs to help folks recover from Helene and help seniors stay in their homes. We're improving emergency response times to ensure better outcomes for our community members and increasing economic opportunities. I encourage everyone to follow along with us, where we will be tracking our measurable goals that are directly tied to our strategic plan. And with the Unified Fire Tax, we are increasing the pay of our first responders and improving their overall safety and the safety of our community. This is important progress. And Commissioner Ball strongly advocated for increasing the supplemental tax funding for Asheville City Schools both this year and last, and I appreciate his efforts as we continue to prioritize education with the largest percentage of our budget. We worked to balance the needs of our community as we continue to invest in our recovery. I support this budget in order to have a better future for all of Buncombe. We all benefit from safe and affordable housing, access to healthy food, economic opportunities, clean air and water, high-quality education, healthy recreational opportunities, and a well-trained and resourced public safety. This is our mutual responsibility to invest in our recovery and our future. And I believe with all of that, we are building a stronger Buncombe County for all of us.
Thank you, Commissioner Wells. Other commissioners?
Thank you. So I didn't support last year's budget and tax decisions, but I am and will support this year's. I think it's a good compromise. In difficult circumstances, I think it's the right selection of choices that we've made. But ever since Mr. Hudson provided us with the budget drivers for FY 2027 back in April, I haven't been able to shake that out of my head. So I just wanted to talk about some of those, hopefully for the benefit of the community, and talk about it in the context of kind of what's happening in the country in terms of what we've been seeing, the tax burden shifting from the rich to the poor is essentially what we've been seeing in North Carolina for many years, and what we've seen in Washington accelerate over the last few. And I'm probably getting a little bit more political than I'd like to think I usually do at budget season. The budget increases, the drivers of the budget increases, to summarize, this year comes from inflation, comes from the restoration of Helene impacted budget cuts that we made last year. It comes from increased healthcare costs, and it comes from neglect by the state and by the United States Congress. To list some of the specific drivers, I think that stand out to me. The first is the $2 million drop in Health and Human Services. That's a direct result of last year when Congress passed the One Big Beautiful Bill to partly pay for the cuts on taxes for rich folks that cut health care. And this is our bill for that decision. So that comes with a cost, and that's just the number in the spreadsheet. The cost that comes from cutting health care to a society can't really be measured. We are increasing this year K-12 local school expenditures by $11 million based on that formula that I think is one of the best things this board's done since I got elected, was agreeing on a formula. I think it's a great thing, but it is in part happening because of neglect in Raleigh and not appropriately funding public schools, not understanding and realizing and accepting that our kids are our future and it's our economic future, and education is directly tied to how we pay for things and how our society functions, and what costs there are in turn. Like I mentioned, we're increasing, or bringing back rather, our $1 million investment in affordable housing, our roughly $1 million strategic partnership nonprofit investment. in the community, which I think is two very clear reasons why local government should exist, is to help fund those types of things. We have a $5 million increase in health insurance costs this year. That's a big driver of the budget this year. I think that's been lower in years past, but one could make the argument that, in our society, we are leaving health insurance costs rather, an unnecessary burden on employers like Buncombe County. It's a choice we're making that we don't have to make as a society. There's also an increased cost for health care of $1 million for the jail, struck by what the sheriff told us earlier, that the Buncombe County Jail is the largest mental health provider in Western North Carolina, and that comes at a cost. It shouldn't be the sheriff's job. It shouldn't be county government's job, but that mental health care and broadly health care neglect by the federal government and by the state comes with a cost, and that cost is bared by Buncombe County property taxpayers. And I would just close by saying, my whole life I've been hearing folks describe government like it can be run like a business. And it can't be said enough that that's not true. I would challenge anyone to run a jail or a transit service or a health department or a parks department or a school like a business. It can't be done. It's a different animal. And when we think of it that way, when we think of taxes that way, we're going down the wrong path. And those choices that we make, those choices of neglect and delay and sabotage at sometimes come with a cost that today is in part bared by the property taxpayers of Buncombe County. So sorry to end that on a negative note, but it is true and it needs to be said. I think these budget drivers for FY 2027 are, some of them are just completely mind-numbingly unnecessary. Some of them are important restorations of Helene-impacted budget cuts that we made in the past. But I would just challenge those to realize that it doesn't have to be this way. We can live in a different society where these costs aren't as high and aren't bared by property taxpayers and little old ladies on Social Security that are having to pay this kind of thing. So, thank you.
Thank you, Commissioner Sloan.
Thank you both. I'll elevate a couple things you said and appreciate all the hard work. Commissioner Wells, I know, has worked really hard to find cuts and savings in this budget, so thank you. I want to elevate just a few pieces of this budget that I think are worth highlighting. It's been months and months of working on this alongside fellow commissioners, and I appreciate the hard work of our staff and how much work goes into this. I feel that from public safety to parks to schools to air quality, this budget invests in what matters to our residents, what our residents expect county government to provide for them in exchange for their hard-earned tax dollars. I think our new formula for our school funding provides stable and predictable and increased funding for both Buncombe County schools and Asheville City schools, and that has resulted in $11.3 million increase for our public schools, even more when you look at the ACS special tax increase. And I want to thank our school partners for all of their hard work and working with our staff to make that happen. I know it was a heavy lift. The budget also provides a significant increase in funding for our fire departments. I know that's critically important after all they went through during Helene, and we thank them so much for their service. I appreciate our fire chiefs being active partners in working through this. This budget allows for increased starting pay for many firefighters across the county, increase in the number of firefighters on duty, increasing their ability to respond, and so that helps ensure that they have the equipment that they need to respond to whatever happens. So for the public, that means faster response times, whether you're at home or disaster strikes on the road as you travel across the county, or even on the trail in a remote portion of our beautiful county. And I believe this budget provides funding to ensure that we're investing in what matters, from housing to homelessness prevention and to our recovery. We are less than 2 years out, and I appreciate staff and fellow commissioners not losing sight that we need to look towards the future and be thinking about what future disasters could mean for our community. I think, as Commissioner Sloan pointed out, there are a lot of increased drivers for increased increased costs. Just like household budgets are getting harder and harder to balance, it's getting harder for the county to balance due to inflation and increased healthcare costs. We have a number of unfunded mandates that get pushed down to us from the state that we're required to provide. And even as the state has failed to pass a budget, they seem overly fixated on how we balance ours. We have to keep in mind what future mandates may look like from the legislature, and I think this budget tries to do that. We even heard today during the briefing from our sheriffs and public safety experts about how recent laws have increased our jail population, increased jail healthcare costs, and we at the county level have to struggle with how we deal with that and how we rectify those issues. We have a number of costs being pushed down from the federal government. The big beautiful bill, under the guise of cost savings, really just passed a lot of costs down to counties. And we have many fewer tools to work with to try and balance these budgets that we have. It's unfortunate when the federal government passes those down to us. As I mentioned, increased costs for our healthcare plans as those go up across the country. And we've seen increased costs for utilities as those rise, and Duke Energy seeks to increase rates. Again, I really appreciate the hard work of our staff, and we really value our staff. Our people are our most valuable asset here at the county, and that has been proven time and time again. I believe this budget leaves our fund balance in a healthy place, which is critical to protecting our bond rating. And I think that's really commendable, even after the difficult decisions we made last year to balance our budget post-Helene. And as we look forward, I think our fund balance will be in a good place for the fiscal year. So with that, I appreciate everybody's hard work and look forward to taking this vote.
It's the great part about coming after esteemed colleagues is you get to either repeat something or miss something. I'll just highlight some of the same challenges and things that we've already raised, just to give people a perspective on why I think it feels so hard to come up with a perfect plan, so to speak, because I don't think there's ever going to be a perfect budget. I don't think there's ever going to be a scenario where everybody walks away fully happy. That generally means you failed someone greatly. But in looking at the challenges that we faced, I mean, we're dealing with increased cost of living across the country right now. Inflation is real for every community. There's not been a year that I've served on commission so far where we have not dealt with consistent underfunding of our schools at a state level. And that's a challenge that's going to continue, as best I can tell, for the foreseeable future, and is going to continue to be a pain point for a lot of us in figuring out how we do our job working uphill against our own government sometimes. I think what I've seen and learned better each year is the burden being shifted to municipalities and local governments, and that means our residents and our community is becoming increasingly more real. And that's not something that we can solve alone, so I think we have to brainstorm and try new things with each other as we move forward if we want to talk about better outcomes, because I think regardless of where you fall on the spectrum, everyone is working toward the same net goals. How we get there is going to change. How many work sessions you choose to come to as a community is going to change. But I don't think you're looking at a staff that's unwilling to do the work and to hear from constituents and to have the listening sessions necessary to get better outcomes each year. And I am proud to say it from last year, where we did have a lot of really hard conversations. We are moving the needle in the right direction, despite things not being or getting very much easier at an institutional level for the decisions we're making. Commissioner Sloan said something that I've heard several times from people who are extremely critical of the budget process, some names that I've observed multiple years, and the comments about running the government as a business. And I hesitate to comment too much on that, only because I have law school professors who would slap my wrist for the answers that I'd want to give there. But I do think it's a fundamental flaw or in the logic of viewing that, because there is no business in keeping your community safe. That's not something that you look at the black or the red. You're looking at doing the best you can to be good stewards of the money, but also not doing things that are going to cause harm to people in your community. We talk a lot about health and well-being in our community, and sometimes I think we forget how broad a scope that is and how many people go into making sure that our community really is safe, from our first responders, our emergency services folks, firefighters, sheriff's deputies, community paramedics, co-responders. These programs are all funded by county dollars. Our investment in our justice system to make sure that we're getting fair and just outcomes for people who live in our community, who interact with those folks, and making sure that everybody are just treated well by systems that we put a lot of faith and trust in that have some severe consequences on people's lives. And looking at what the Health and Human Services Department does to promote wellness in times where we're having natural disasters that devastate communities that we're still recovering from, or pandemics that require and could have looked a lot different had we not had people who are trained, educated, and ready to tackle those challenges and willing to do so, despite knowing that we are not paying anybody as much as they truly deserve. Even things that people don't think about on a daily basis that are so critical in our democracy are election services folks. You're not going to see them on the newspaper very often, but when you show up to vote, a lot of times people forget that doesn't happen by accident. You're not showing up there and you're having an easy process, or even when you have to wait a little bit. That's happening because people are investing their time, energy, and putting a lot of work into making sure that everything runs well to the best of their ability. And I don't want to lose sight of that as we're being critical of what we could do better. We can do better, we have to do better every single year. But I also don't want to sneeze at the tremendous effort that people have put into so many things in our community. We're continuing to invest in affordable housing at a time where housing costs are going nowhere but up. In communities where people are cutting and trying to trim the fat, so to speak, we are still investing in early childhood education, which everyone seems to agree is critical to the long-term well-being of our community and our future. I've yet to hear someone tell me early childhood education is not important. And we're improving conversations and getting better at how we make sure that our students and staff within our schools are getting what they need to be effective students, learners, folks who are getting what they need to be good educators. It's never going to be perfect, but I think the big contrast for me and why I feel better this year supporting the budget is because I'm seeing the things improve at an institutional level. I'm seeing the conversations happen. I invite people to continue to talk to us. There's no doubt in my mind there's something we can do better. That's always going to be true. But in terms of net improvement, I think you're looking at a body that has spent a lot of time trying to figure out how to make us do things a little bit better every single year. For too many in our community, we need to do more, and the funding for critical services is not enough. For others, the cost is too high, and we're impacting folks' lives. I get it. I understand all of that, and I look forward to continuing those conversations. But after multiple work sessions, countless discussions, seeing our boards work at every level across bodies that I didn't even think interacted with each other, I'm really proud to say I do see a marked difference between where we were 2.5 years ago and where we are today. And I'm proud to say that happened because you put your faith in people who are willing to have those hard conversations and think outside the box of 9 to 5. So thank you all for being with us in this, and look forward to continued discussions about how we do it better.
Thank you, Vice Chair Moore.
Okay. It's my turn now.
We'll just go down the dais this evening.
Folks, this is my 10th budget. And when I stepped in this 10 years ago, really almost 10 years ago, that was after working in banking for 40 years. I thought I had an idea of what it would be like being in government. But nobody told me that 6 months after I was appointed, we had a breakdown of county government that ended in, 6 people going to federal prison. Nobody prepared me for COVID to come a few years later. And now, we look at what Helene did. But what did was obvious to me is this. Thank goodness we have the people of Buncombe County behind us. And the one thing that I ran on is quality of life for all of the citizens in Buncombe County. And folks, it's painful sometimes. And I commend our staff, my colleagues here, all of us, because we have really worked to make sure that the quality of life, in spite of the roadblocks we are seeing from Raleigh, from Washington, but we have concentrated on what we can do here to make life better for all of us. Sure, it's a little pain in property tax because we all pay property tax. I know exactly what you mean. But when you look at the services we get, and when you look at what we pay and compare it to other counties our size in the state, you'll see, and I have a lot of friends of mine across the state who are commissioners, but we give, I think, the services and the best that we can get for the money we spend for the people of Buncombe County. Now, I know some have some concerns about the decisions that we make, but the one thing I don't think anybody questioned is what we are doing is for the best of Buncombe County and for the people who live here. Sure, as commissioners, we make decisions. We all don't agree on everything, but I think one thing that we all agree on is when we come to a consensus, we are determined to do what's right for Buncombe County. I know some of you out there looking at me like, where is he coming from? What does he understand? But folks, I've lived in this county now for over 81 years. I've worked in the county, everything from Salvation Army Board to 8 years on the city school board. So I think I understand what's going on as well as anybody. I have people, customers that I still talk to who live in Barnardsville, who live in Broad River, who live all over the county. But the hard part of this job, it's not like when I worked in banking, it was easy to get to the bottom line and make money, that's it. But here it's not about that. It's about what we do for the community, what we do for you, the people, or for all of us. And that's something that I hope we don't lose track of, because I know you hear a lot today about this and that, but all we are trying to do is make sure that we do what's best for the people of Buncombe County. And I think we've done a good job with this year's budget and where we've come from the last 10 years. And we're finally getting to the place that we've stopped kicking the can down the road on a lot of our programs. And we're beginning to take them to the next level. And it's not going to be easy even next year, because when you look at the things that are going on nationally and statewide that we have to work in. But what we do, we listen to you. You know, I call people back, I talk to everybody, and some I call before they can call me. But I hope that you understand that what we are doing is for the best of the county and for the people of Buncombe County. And we might not always all agree, but hopefully at the end of the day, when you look at the schools, affordable housing, you look at what we do, we're giving people the services that they deserve. And all I can say is, as we go forward, we'll do our darndest to make sure also that we hold everyone accountable here in Buncombe County, as well as ourselves, to stay with our strategic plan, to follow it, to make sure we continue to give you the best services possible and keep the costs down, the tax rate especially. And that's all I can say is we need your support going forward that we've gotten all along. And we guarantee you that you'll get ours for the people of the county, and we look out for that. Because that's the only reason I'm here, and I know most of our county commissioners is the same. You know, I could be doing a lot more retired, taking life easy, but I really want to make sure that this county that I've lived in all my life, that when I leave here, we can say that they did what was best for Buncombe County.
Thank you. How do you go behind that? I mean, we have had, Terry gave a great breakdown of the budget. Parker gave some politics. And I believe I'm gonna start with, as Hurricane Helene survivor and a lifelong resident of Buncombe County, and a woman that was sworn into office 2 weeks after giving birth to her baby girl. This budget wasn't easy for me, knowing that we were still in recovery, that we are still in recovery. We've not recovered yet. But I am pleased with what we ended up with. We made a lot of sacrifices last year. I'm going to add a few things to what Terry said. I don't think I like this mic. So those that are in the mental health field knows that we have had an increase in our suicides in our high schools. So, but we gave to the behavioral health in Asheville City Schools this year. When I seen that, it really just meant something to me. We also, the adult day program, education, K through 12. I just want to close and say, because I'm not long-winded. My focus is not just passing a budget. My focus is making sure that this budget serves all residents, because these residents of Buncombe County are my neighbors, my friends, my families. We protect essential services, and we build public trust. Commissioner Whiteside said something about accountability. As your commissioner, I promise that I will hold those that we give funding to accountable. Staff has always been transparent. I feel like I'm babbling here. But it's an honor to serve, and I feel good about the budget that we passed tonight.
Thank you. Thank you, Commissioners. First, I would like to thank Avril and John and each of your teams for getting us to this point to be able to approve a budget this evening, and to all of our partners that are a part of this budget for, I think the skies are opening up. I'm not sure if that's an omen for our budget vote or not, but to continue, would like to thank all of our partners who are part of this budget, and to all of the services that you provide that we support. And lastly, to each of our commissioners, thank you. This has been a long, tedious process from November until this evening. You all have been diligent, you've been thoughtful, you've listened to residents, we've all listened to residents, and taken those comments and those concerns deeply to heart as we have worked through our budget process this year. And tonight's vote is a culmination of all of that hard work, that listening, that digging in line by line to the budget. And I would just simply want to say thank you for that, for the thoughtful work and for the thoughtful comments that each of you have made on the dais this evening. For me, tonight's budget is a statement. It's a statement of our belief that our best days in Buncombe County are ahead of us. And it's a belief that we can weather our short-term and our long-term crisis while providing what we're required to do, which is provide effective and efficient services for all residents of Buncombe County. And with that said, I'm incredibly proud to support the budget this evening. If there are no further comments, may I call for a vote? We have a motion on the floor to pass the annual budget ordinance, and a second. We have a motion and a second.
Call the question.
All the question, all in favor?
Commissioner, I
Yes, ma'am.
believe she said all, both annual and capital ordinance and a resolution, so make sure that's in the motion.
Yeah.
I thought we had to do those separate, Kirk.
Yeah, we don't.
Motion was already made and seconded for approving the budget. Let's approve that, and then we can come back and do the capital.
Capital and the, okay.
I believe her motion included all of them.
Did it include
They don't
all,
have to
Terry?
be second. Resolutions, correct.
Okay.
Okay.
Yes, they've been seconded. I just needed the refresher. Thank you for that.
Okay, so we're approving the budget ordinance, capital ordinance, and the resolution for the
Opioid
opioid
settlement. That is
at
correct.
the same time. Okay.
All at the same time, if we can do that.
Yes.
All right, all in favor?
Aye.
Any opposed? Budget passes unanimously this evening. Thank you, staff, community members, and commissioners. All right, thank you, John. Okay, we move into our first item of new business, which is our general obligation bond referendum. And Melissa Moore is on her way with additional information. Thank you all for joining us this evening. We appreciate it.
Hello, good evening. So this evening is the second step moving toward the 2020 GEO bond referendum. So as required to introduce the bond orders, so I will read those bond orders as a requirement of the local government budget. I'm sorry.
Hold on just a moment, Melissa. We'll let everybody leave. We'll give you a moment of quiet. All right, I think we can hear you now.
Okay, thanks. All right, so I'll start over. So this is the second step in the process of moving forward with a 2026 GEO bond referendum. So a part of the Local Government Bond Act requires for a formal introduction of the bond orders. So I'll read those now. Introduce the first bond order is the bond order authorizing the issuance of 30 million general obligation open space bonds of the County of Buncombe, North Carolina. Second bond order is the bond order authorizing the issuance of 40 million of general obligation housing bonds of the County of Buncombe, North Carolina. So the second action for this evening is to adopt a resolution. This resolution is setting a public hearing. It is to direct the clerk of the board to publish bond orders and a notice of the public hearing. It is to direct the finance director to file with the clerk and the local government commission a sworn statement of debt, as well as a statement of disclosures, and post that statement of disclosures on our public website. So the next steps, I will come back to you at the next board meeting on June 16th to hold the public hearing on the bond orders, to adopt the bond orders, and to adopt a resolution setting a special and bond referendum.
All right, we have two, can we go back to that slide, please? It's our two requests for action this evening. Oh, it's on our screen. Okay, great.
It would just to be to adopt the
Resolution. Are there questions for Melissa this evening?
Yeah, go ahead.
Approve the resolution setting public hearings on bond orders and directing publications of notice.
Second.
All in favor, say aye.
Aye.
Any opposed? All right, we have approved the resolution. And we have two resolutions to do separately.
Is that a motion for both resolutions?
I think we're supposed to do those separately. Did you include them all together?
I include them all together. I'm happy to say it twice.
Hearing. And one was, okay, we're good. Thank you, Kurt. I want to make sure we're all right. Thank you, Melissa. Thank you, commissioners. All right, Rachel Sawyer is joining us to give more information about COVID recovery funding reallocation. Good evening, Rachel.
Good evening, Commissioners. I'll only be at the microphone for a moment. I'm here to introduce Jamie Brown, who you've met before, who works as grants manager within strategic partnerships as the person responsible for staffing the ARPA funds, the American Rescue Plan Act, coronavirus funds that are known here as COVID recovery funding. So we briefed about this item a couple of weeks ago. It's a request for board action on reallocation, and Jamie will walk you through it.
Good evening, everyone. Sorry. So as Rachel said, we're here to talk about the state and local fiscal recovery funds, which are part of the American Rescue Plan Act, or ARPA. We are coming into the final 6 or 7 months of the grant life cycle. So
As you know, the funds were awarded to the county to combat the negative economic impacts of COVID-19 in our community. And Buncombe County received $50.7 million as an allocation. ARPA was signed into law in March of 2021, which is when the expenditure period began. The important dates to remember were December 31st, 2024, which was the obligation deadline, where all of our funds had to be fully obligated per the compliance rules of the U.S. Treasury. I do want to point out that we did obligate our funds fully, but that obligation deadline also meant that we could not create any new projects after that date. December 31st, 2026 will mark the expenditure deadline when all of our funds need to be fully expended and paid. The eligible uses for the grant funds were 1 through 7 were actually the original expense categories: public health, negative economic impacts, public sector capacity, premium pay, infrastructure, revenue replacement, and the administrative support. Throughout later in the grant, they did add 3 additional expense categories. The expense category 8 for emergency relief from natural disasters actually benefited our community following Helene. I did mention all of our funds were fully obligated by December 31st, following all of the guidance provided by the U.S. Treasury. And here's just a quick snapshot of how those funds were divvied in terms of the categorical use between affordable housing, homelessness services, down to the nonprofit economic assistance and additional housing assistance. We have a total of 54 projects. 36 of those were community-led, where we worked with community partners. 18 of the projects were led by the county. Again, the full $50.7 million was fully obligated by the obligation deadline. As of May 1st, about $44.5 million has been spent, a little bit more since May 1st. We're probably closer to 90% fully expended. Of the 54 projects we created, we have 8 that are still in process. We do have a web page on the county webpage that details the breakdown of the expenditures to date, including the projects that have been completed, where we provide spotlight reports where anyone can get more information. Today, we're here to talk specifically about closeout. Like I said, we have about 6 months left. We are here to talk about reallocating the unused project balances. We're going to close out our remaining projects and then ensure all of our compliance reporting is in order and that we have audit-ready record retention. Reallocation constraints. We are very limited on how we are able to reallocate funds between existing projects. Again, we are not able to create any new projects, and we can only reallocate funds between open projects. To remind you, we have 8. And all fully expended, all funds have to be fully expended by the 31st of December. And just to I want to point out also, we can only reallocate between existing projects, and we cannot expand the scope of work of any of those projects. So it's really to cover overages in the contracts. This is a list of what we are projecting as available balances for our open projects. Some were unused funds. Others, the biggest pot project of money being Cox Avenue, the affordable housing development. That project continues to move forward for the county, but due to Helene-related delays, we are not able to utilize the funds with the state and local fiscal recovery grant. We are proposing that we reallocate funds to two projects. One is the Community Paramedic Collaborative, and it's for the purchase of radios for the program. The bulk of the money we would like to reallocate for our project and operational costs for Helene response. We've worked with our finance department to identify expenditures that do not have a current funding source. So these dollars would not, I want to clarify, we wouldn't be refunding our fund balance because these don't have a clearly identified funding source at this time, but we would avoid having to use general fund dollars in the future to cover these costs. Some examples of the costs here are emergency protective measures, emergency watershed protection, surveying the damaged stream banks, floodplain management to hopefully prevent future damage as well, and hazard mitigation. Just make sure. And then, so our request for you tonight is to approve the reallocation from the projects listed to the Community Paramedic Collaborative and the operational costs for Helene. Do you have any questions?
Questions for Jamie?
Just one, and I think you said it, all of those operational costs, we would have had to pay for out of our general fund if we were not able to do this reallocation.
That is correct, or some other identified funding source. And then I do want to clarify, I think Rachel covered this a few weeks ago with you, but all of the dollars, this is after any FEMA reimbursements or insurance costs. So these are expenditures that we would have to cover. There's no other funding source identified.
Thank you. I'll make the motion to approve the reallocations as recommended.
Second.
Got a tie on that one, Sarah. All in favor, say aye.
Aye.
Any opposed? All right, motion carries. Thank you.
Thank you.
All right, we have an authorization to acquire real property at 7 South Tunnel Road, and Tim Love has more information for us. Good evening, Tim.
All right, good evening, Chair and Commissioners. Pleased to be with you here this evening. As stated, going to present a little bit today on the acquisition of real property at 7 South Tunnel Road. And to jump into that, just to set the stage, a little overview and then a request before you today. So in 2021, the Board of Commissioners adopted a comprehensive facility plan. And that document at the time looked at all of our buildings across the county and identified a number of necessary changes, facilities that needed repair, new facilities that we did not have. One example of that, and certainly not the only example, was the replacement or renovation of what we refer to as the castle. So that's our Irwin Hills facility, home of our emergency management, but also had been home for our public safety communications, or 911, for a number of years. Additionally, since Helene and in 2025, this board has taken numerous actions to adopt plans that would enable our immediate response and recovery from Helene. And so examples of those are, of course, our Helene Recovery Plan, but also our Preparedness Action Plan, both of which identify a number of necessary changes for our organization to better serve our community as we recover, but also as we deal with future responses. One great example of what was identified as actions in those plans is the identification of an emergency operations center. As you know, and as we saw today, as part of your annual budget process, Commission undertakes the approval of an annual budget, but within that is what we refer to as our CIP, or Capital Improvement Plan. That 5-year, now 7-year plan helps us identify what future facility needs are to address the myriad of needs that we face as a large organization, ranging from, libraries to, emergency services, regional centers, parks as well. Today, to meet those public safety, emergency response, and facility maintenance needs, Buncombe County has identified the purchase of 7 South Tunnel Road to serve as a future EOC and emergency management center. So we'll talk a little bit more about that today, and the request we have before you is to approve the resolution authorizing the county manager to complete the purchase or terminate the purchase if necessary. One thing I would state for this board, but mainly for the public, this transaction is not complete. We have seen sort of posts that indicate that this has been a done deal for some time. That's not true. We're still looking towards our closing date, and we'll talk about that timeline here in a minute, and still have the opportunity to walk away should we deem that important, but also feel like we've done the due diligence necessary to keep moving forward. So, site location. Many folks know this place. 7 South Tunnel Road is what used to be known as your JCPenney's. JCPenney's has been closed for, close to a year now, and the property was on the market for at least 6 months before we were able to put it under contract. On the left, you can see a site layout, but then also the location of the property in Buncombe County, and a few overview stats. So the building, large, over 130,000 square feet, a 2-story building that spans about 6 acres. You're familiar with the location, but a key ingredient here is proximity to road infrastructure. 240, I-40, I-26, very centrally located. Additionally, because it's the mall, and this building has been in place since the late 80s, great utility infrastructure, so water, sewer, electricity. And then a really important aspect as well, parking infrastructure. The JCPenney site is adjacent to a parking deck, but also surface lots that we view as an advantage to serving many of our needs as we move forward. As we think about potential uses for this facility, a large facility, but some of the key uses that we see, of course, I've already mentioned the Emergency Operations Center, relocation of our emergency management function, which currently resides in what I've referred to earlier as the castle. Our public safety communications, again, our 911, and then, other county uses moving forward. One thing I would state here, as we've devised our planning around this, we don't view this as a facility that would provide direct services to residents. So that's not necessarily something that's in the cards for us. Our primary considerations really are what you see here, which are very much public safety, emergency management related, and enabling our ability to continue to recover and respond better as we move forward. The deal terms, just a couple quick snippets here. The price of the property is $5 million, slightly below the asking price. This comes out at about $38 a square foot, which I would underscore here is a really important point. As we look to meet our facility needs across the county and we think about how we do that, building new buildings is sometimes really appealing because you get to start from scratch. Less appealing when you start to think about the cost. And so building a similar size building in a central location be very difficult to get anywhere in the ballpark of $38 a square foot, and candidly, you'd be looking, closer to $300, maybe even more, depending on what you're doing with the building. The deal included earnest money, which is standard within most real estate transactions. Our inspection period, or due diligence period, if you will, was completed on May 22nd. And then our closing date, as I noted earlier, has not occurred yet. Will be in the future in June 8th, should this board approve this item this evening. In terms of due diligence, we've gone through a number of paces on our side. We, of course, completed an independent appraisal to determine the value of the site. When I say independent, very important to note, we didn't do this in-house. We hired out for this. The appraisal was completed and came back where we needed it to for our asking price, which is $5 million. We also took some steps to do some environmental work. So we did a phase 1, which came back clean with no issues, and because of that, no need to follow through and do a phase 2. We've also done extensive title work on the site. This is a unique transaction for us, commercial property, a part of multi-party agreements, multi-tenant agreements with the Asheville Mall and those tenants. And so brought in outside legal to help us navigate the myriad of documents since the late 80s that define the terms of what it means to be a part of that structure. That title work is complete, and we identified no showstoppers for us there. So let's talk about the benefits of the site. I think there's many, but we'll try to keep it brief. So I've hit on some of this already. This is a developed facility. It exists today. And with that comes some great benefits, namely around infrastructure. So much of the cost that you face when you're building a new building or renovating an old one is about prepping the site. So how do we get the horizontal infrastructure in place, water, sewer, electric? All of that exists today. Another cost that you see often relates to parking, and we can argue about how much parking is too much parking, but in this case, we believe that the parking deck and surface lot will be advantageous for the response that we intend. Proximity of the site is great. Central Asheville, proximity to road infrastructure. Also have to underscore post-Helene, the site was not impacted. Nearby, of course, we saw some devastating impacts, but this one was not, in large part due to its elevation. We view that as an advantage as we talk about a facility that will house critical operations that we cannot have impacted post-storm. From a community standpoint, a lot to say here. I'll keep it brief. I think this is an opportunity to strengthen the Asheville Mall and Tunnel Road commercial corridor. The reality is this box has been vacant for some time. We've seen other commercial property on this corridor sit vacant for extended periods of time. We think that us being a part of this commercial corridor is a good thing. I think we'll bring some vibrancy. I think we'll bring people. I think this will be a good thing from an economic development standpoint as we think about this location and this corridor. Looking at our project benefits, number one, we have to lead with our business need. We believe this will provide a resilient hub for emergency service functions. That's why we're here. It was identified in our Helene Recovery Plan, in our Preparedness Action Plan. Post-storm, many of y'all know, we were forced to relocate our EOC on multiple occasions, in large part due to the lack of a facility such as this, where we could house not only our internal staff, but also our partners, municipal, state, and federal. And in some cases, those that came from out of town to support us. You know who they are. So we view this as a great business need. Additionally, offers an opportunity for consolidation. We're not exclusively interested in consolidating all of our footprint into a single building. I've seen that online as well. However, where it makes sense and combining similar functions that benefit from being in close proximity, such as public safety and emergency management, we think that's a great thing. And so seeing 911, EM, and EOC coming together in one building sounds like a great opportunity, especially one that's resilient. Additionally, because we're consolidating, this allows us to look at our footprint a little bit differently. And so namely, as we look at again, the Castle or Irwin Hills, as we completely vacate that facility, that gives us an opportunity to look at what we can do there. But importantly, from my perspective, gets us out of a building that has many maintenance issues. And it's a great building. It's got its charm, but it's certainly a fixer-upper. And we've spent more than enough money on that facility to repair the roof, fix the foundation, to prevent water from coming in from multiple sides. And we will continue to do that if we stay in that facility, simply because of the way it's been designed and the way it lay on the property. So that kind of got me into my next bullet here, which is cost avoidance. And I think there's a lot to say. I've already touched on the need to maintain and renovate critical public safety functions. We cannot afford to have water coming into a data center in the bottom of the castle, nor can we put a bucket in our public safety communications center to catch water from the roof. So we need to make sure that those facilities are in tip-top shape, as resilient as they can be. And so by investing in a new facility, that allows us to avoid some of those costs that would have occurred in something that's more resilient. Additionally, new construction of comparable critical public safety facilities would be more expensive. We talked about our CIP earlier. You know, that's a 7-year lookout into structures that we need that were identified in either our facility plan or facility study that was adopted, in our Helene Recovery Plan or Preparedness Action Plan, all the plans, right? All comes together in our budget and our CIP. There's at least 3 projects that we think this project will help us tackle, that will help us avoid future costs and make this a sort of a better deal, if you will, for the county. Those examples are an EOC and emergency management facility of, early estimates, $40+ million. Public safety communications, 18 million plus, and as well as storage and warehousing, which you've seen come before this board at least $50 million. So those are big ticket numbers. We certainly haven't engineered or designed all of those buildings, but we know that there is a cost that would be borne in future years. We think this facility will allow us to accommodate a lot of those costs, those business needs, and ultimately save us money in the long term by consolidating our footprint in one house. So as we move forward this evening, we'll talk about budget and funding, and there's a few things to talk about here. So first off, what are the budget estimates for this project that I'm describing to you today? First off, the acquisition, so the $5 million purchase of the location, and then an early estimate on what construction will look like to renovate this existing facility and to make it, resilient. And that early estimate is about $30 million. There's an asterisk beside that because that's an estimate, and there's a lot of work for us to do to really hone this in. And so if this project is approved, we would go into our next stages to design that building and ultimately hone that number. The purchase of the property, the $5 million, comes from existing funding. And so you can see that here. So no new funding for acquisition because we're utilizing existing funding sources, namely existing funding sources from FY24. John will be before you after me this evening to talk about the budget amendment related to that, so you can talk about those funding sources. As we look to the future and thinking about what the additional funding would be, we've of course got design of this facility, and I've alluded to that earlier. That is included in your FY27 CIP budget that you approved earlier this evening, that design cost. As we look forward beyond design and engineering, which is an extensive process that we should expect to take us between 12 and 18 months, we'll look to construction and what those construction estimates are. We'll once again go through that CIP process with y'all, where we'll identify that construction budget. We'll bring the construction contracts before the board, so you'll have an opportunity to approve those. And so, this board will have its fingerprints on that project as we move forward. Finally, as we know with any asset that you own, there will be maintenance. And so we know that that's something we'll have to consider as we move forward, and we'll continue to build that into our operating budget as we move forward to make sure that the building's clean, that the lights stay on, and do all the things that we need to do to maintain a building. One item I would state here, really important to underscore as we think about the budget, this is not just a run-of-the-mill county facility, right? I've described to you already what's going to be in this facility: emergency operations, emergency management, 911. Extremely important that we have resilient infrastructure as part of this facility. And so as we design that facility, we're going to make sure that, we've got those redundant power sources, that we're thinking about renewables where we can, all of those different things to make sure that the lights stay on when there's a gray sky. So really important to underscore that for you. So, next steps and request. Next steps, the authorization to purchase, that's tonight, June 2nd. The closing date, June 8th. And then, we would begin our design process July 1, I say, as we get into our new fiscal year. Of course, it'll take a little bit of time to get us started. The request before you this evening is to approve the resolution authorizing the county manager to complete the purchase or terminate the purchase if necessary. So those are my slides and my presentation for you this evening. Open to any questions that you have.
Thank you, Tim. I appreciate the presentation. I just want to first say thank you to you and the staff and the real estate professionals for working to negotiate a purchase price that is not inflated. That is no small task in the current environment, so we do appreciate that. I also want to say that this is something that I have focused on for the last 8 years. And I think it's one of the things that Taylor and I have bonded over, as well as others amongst county staff, is the need for an emergency operations center. Having been out in other communities working in a disaster space, seeing what other emergency operations centers look like and the importance to that, particularly in the realm of public safety. And I think we've all said the next disaster. It's incredibly important that we have that space. I think this is a step forward for Buncombe County to have a more strategic and responsive approach to our emergency operations, to our emergency training, to EMS, as well as our telecommunications. And I said earlier, our role is to provide effective and efficient services to our residents. Having an emergency operations center and a central place for emergency management is a key to providing those effective and efficient community services. And I think it's also showing that as commissioners, we're listening to our residents as well, who have continued to applaud us for our public safety investments and have asked for us to continue supporting and investing in public safety. And while this does have a significant price tag ahead of us, you have also laid out what those potential costs could look like if we were to go other routes, whether it is to invest in the renovations of the castle, continuing those maintenance issues that are increasingly expensive, or other options that are ahead. So I think it shows that we are ready to be good stewards of county financial resources as well. Commissioners.
Tim, thank you for this. Just to confirm, this deal is not done and the county is not housing anything in this facility currently.
That's correct. We have not closed on the property. It's not in our possession. We have nothing in the building.
Okay, so this allows the county manager to close the deal or continue to negotiate or terminate if anything were to come up as we continue this.
That is correct. We are not at a point where we couldn't turn back if we needed to. And at the end of the day, I know our manager, and we're going to make the right deal for the county no matter what that is. So.
Well, I really appreciate the continued focus on public safety, and Helene taught us a lot, and the need for a new EOC is a clear lesson learned. The castle is in a pretty remote area, and I'm excited about the central location. You can hop right on I-40, 240, Tunnel Road, and that is going to be incredibly important if communication goes down and we need to gather. It's important for the community to understand that an emergency operations center is where county staff and leadership go to coordinate response. Counties are tasked with being the front line of response when disaster strikes, and so it's critically important that we take this seriously and think ahead and take those lessons learned so that we are being responsible stewards of public safety and ensuring that we can gather and make tough decisions when disaster strikes. I'll also note that a couple weeks ago I attended a gathering about what we're seeing on Tunnel Road. Neighbors were there, business leaders, business owners, Mayor Manheimer, saw Council Member Mosley there. It was a packed room. Service providers, homelessness service providers, and this was a big concern and topic of conversation, and a big part of what we're seeing on Tunnel Road is vacant buildings leading to more issues. So I'm excited that the county could play a small role in helping kind of alleviate some of the issues that we're seeing on Tunnel Road by being part of this. So Yeah, I'm excited about this process, and thanks for all you're doing.
Just to reiterate, and so for the purchase, there's no new funding. We already had that. Most of that, I think, was in our FY '24. Over 4 million of it was there, and then the rest of it, I think you showed, or John will show. And then for the design, that's we just approved in our current budget. So all of that is already in there, so no new funding for that. So thank you. And yes, I think when I was looking at all the different things we've had on our capital plan for a while and those costs, I'm very glad to see that we're looking at this very strategic location where we can bring a lot of those different services you provided under one roof rather than building multiple buildings all around. I just think for the long term, that's going to be it's going to save money, and it's just going to be really smart for the county and make our services stronger for all those future needs.
I'll just add, Tim, I know one of the many reasons to hopefully do this, and I'll knock on some wood there, is to improve the quality, the workplace quality for our E911 staff. I know that's a kind of recurring, difficult position and an incredibly hard job I can't even imagine signing up to do. So I hope this can be a way that we can kind of improve the work quality of life for those folks. And when we get into the design discussions in the future, hopefully that's something we can think of. Is there anything extra we can do physically in the space to kind of make it a better environment for them even more so? So thank you.
Thank you.
Commissioners, do we have a motion to approve the resolution authorizing the county manager to complete the purchase?
Motion to approve the resolution.
Thank you, Commissioner Horton. Do we have a second? Thank you, Commissioner Sloan. Any further discussion? All in favor, say aye.
Aye.
Any opposed? Resolution carries. Thank you so much.
Thank you.
We appreciate it, Tim. We have a budget amendment for storage facility, and John Hudson is here with more information.
So this budget amendment increases the budget for the fiscal year '24 new storage facility project by $1,045,600 and renames the project fiscal year '24 new Emergency Operations Center Multi-Purpose Facility. This is accomplished by reallocating $500,000 of remaining budget from the fiscal year '24-35 Woodfin forward-facing project, reallocating $300,000 remaining budget from the fiscal year '25-35 Woodfin 911 Backup Center project, and adding budget of $245,600 using debt proceeds as the offset. This budget is now $5,257,600 and will cover property acquisition costs for the project.
Are there any questions for John? Not, do we have a motion to approve the budget amendment?
Motion to approve the budget amendment.
Thank you, Commissioner Sloan. Do we have a second?
Second.
Thank you, Commissioner Horton. All in favor, say aye.
Aye.
Any opposed? Motion carries. Thank you, John. We have another budget amendment for the approval of the USDA Natural Resources Conservation Service Emergency Watershed Protection Program. That's a lot to say. And I believe Jennifer Harrison is joining John this evening. Jennifer, thank you for hanging out with us for a while. We appreciate you.
Good evening. It's a pleasure to be your last speaker tonight. I am here to share the good news of a grant that we have received to address stream banks in the wake of Helene. So just to remind you what the Emergency Watershed Protection Program is, it is a federal grant program run by NRCS, which is the Natural Resources Conservation Service, and it has a narrow scope. So it certainly is not designed to recover all of the stream bank damage that we received from Helene and other storms. And instead, it is here to help stabilize stream banks, remove waterway debris, and establish ground cover, eliminate or minimize erosion primarily. To remind you to be eligible, and not necessarily you, but also the community, to be eligible, you could be either public or private land, but you had to have damage to infrastructure or imminent damage to infrastructure. And so we had to be able to provide for erosion control and/or to help future flooding mitigation. And there had to be active threat to life or property. That was the one big challenge for a lot of our community members who reached out and were hopeful to receive some assistance. Really, once again, a narrow scope for what the federal government saw in terms of damage to life, safety, and property. And also very important, the cost of the project needed to be less than the value of what we were protecting. So to be good stewards of public dollars, we didn't want to spend more on a repair than what we were protecting. So just to remind you, you've, I think, seen something like this before. On the left, we have damage from Fred, and this was typical of what we saw in Helene as well. And on the right, this was what we were able to do with the program. So you can see that we were able to remove the damaged woody debris. You can see that we were in very close proximity to a house. We were able to slope, grade, armor the bank, and revegetate. And this site held up well through Helene. So the budget. We have just shy of $37 million to conduct projects on 207, we call them sites. They are project sites, so not necessarily individual properties, but project sites. The funding is broken up into two different funding sections, and they remain separate, so we can't move money between them. So the first is the construction costs. The federal government calls that FA, or financial assistance. That is $33.5 million. And something to note here is that it's 100% covered. Usually EWP has a 75-25% match, and for our Helene impacted sites, they are covering the cost at 100%. And then the second bucket they call TA, or technical assistance. That's the money we have for engineering and to do the design work and acquiring the permitting. That they fund us at approximately 10% of construction costs, although I was sitting back there and did the math, and that's not exactly 10%. But we generally have, our estimates usually are about 20% of construction costs, so I'll address that in a minute. To remind you, EWP is reimbursement, so we will cover the cost and then request reimbursement from the federal government. And that it's not lump sum, so we have to prove that we've paid these expenses out. So if we don't expend all of the funds, we will not receive any additional funding. So we estimate usually 20% of construction costs, which means we have a shortfall on our engineering side. The way we've been instructed to address this is to go through our normal process, which is we request qualifications for engineering. And once we award those, because remember, engineering can only be awarded on qualifications, not price. And so once we find the best engineers for the projects, then we can ask them to give us their budget estimate. And then we have been invited by NRCS to submit those to them for consideration. And then the second thing that is not covered in this grant are the permitting fees. To be very clear, we are covered to obtain the permits, just not the fee associated with the permit. We estimate that to be about $550 per site for about $115,000. We have been in contact with the state, the Division of Soil and Water, which is part of NCDA, and we have been invited to submit for that funding to be covered, likely under their STRAP program with funding that has not been allocated. So we feel pretty good that there are some funding sources out there. Should these not pan out, we will be back. We will not move forward with projects unless we are fully funded. So, the request before you tonight is to accept the grant for $36,991,382.
Thank you, Jennifer. I do believe there are some questions I'm seeing.
Thank you, Jennifer, and thanks for all your work and everyone's that's been working on this. I know this has been a massive, massive project. So it's good to be to this point because I know our community members are anxiously awaiting. And so just because we're not guaranteed yet on the estimated engineering, so my question's around that. So that's great that they're inviting us to apply. But I know we had it as part of our legislative agenda last year, and when we had the presentation recently, it's still on there, and several of us will be going to Raleigh next week. And so we'll be down there, and I just wonder, like, should we still be asking for that? Because it makes me nervous to miss this opportunity when we don't know for sure that this 3 million is there. And so
It's a great question, and I think what we're trying to cover our bases through multiple funding sources, because while we have been encouraged, there isn't a current grant to apply for. So they haven't said, we're opening this back up for grant application. We have received very positive encouragement that the funding will be made available. But I want to be transparent in saying that it's not guaranteed.
Well, I think, so thank you. This is really good timing for us to hear this before we're going down there. So to me, it sounds like we should still be advocating and speaking to this need. And so I'm sure we can follow up. Tim can get numbers from you so that we can all speak intelligently about it while we're there and advocate. So thank you very much.
Are there other questions for Jennifer?
I will make a motion to approve the budget amendment.
Second.
All right, we have a motion and a second. All in favor, say aye.
Aye.
Aye. Any opposed? Motion carries. Congratulations,
Thank you.
Jennifer. This is terrific.
Thank you.
All right, we come to our board appointments this evening, and we do have several reappointments to make. Our first is the Home and Community Care Block Grant Advisory Committee. We have one reappointment and a recommendation for Deborah Alt. Do I have a motion?
I move to approve.
Thank you. Do I have a second?
Second.
All in favor, say aye.
Aye.
Aye. Any opposed? Deborah has been reappointed to the Home and Community Care Block Grant. Sarah, that was made by Commissioner Whitesides, and I think seconded by Parker Sloan. Commissioner Sloan. All right, we have a Library Advisory Board reappointment and a recommendation. Lena Stapleton.
I move that we reappoint Lana Stapleton to the Library Advisory Board.
Thank you. All in favor, say aye.
Aye.
Aye. Any opposed? Lena has been reappointed. The AB Tech Community College Board of Trustees has a reappointment and a recommendation for Dr. Joe Barwick.
Motion to reappoint Joe Barwick.
We have a second.
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 All in favor, say aye.
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 Aye. Any opposed? All right. Dr. Barwick has been reappointed. And the Asheville Regional Airport Authority has a reappointment and a recommendation to reappoint Jean Bell. All right. Motion to by Commissioner Whitesides. Do we have a second?
Second.
Thank you, Commissioner Sloan. All in favor, say aye.
Aye.
All right, Mr. Bell has also been reappointed. We still do have vacancies on our boards and commissions and encourage people to apply to join one of those. It's a great entry into local government. All right, commissioners, does anyone have updates from boards and commissions that you serve on?
I have one quick one. So with our North Carolina Association of County Commissioners, the legislative goals submission is open. So all of you find that, it's in your emails. I know we've been getting lots of emails, but find that, please. And the deadline is August 14th. And I know there's been a lot of interest around our goals of what we move forward as an association. So I think it's really important this year, probably more so than ever. So please take a look at that because we're all able to submit what we're interested in with some goals, and then it will explain the process too that it goes through. But now's the time, if there's something that you really have on your mind, it's time to go ahead and submit that.
Anyone else?
May I ask a question?
Yes.
Commissioner, are you looking at those individually as an organization, all those goals?
I think actually at this point it's individually.
Okay.
Yes, so we can individually, I'm going to go on there. I haven't looked at the actual form, but I'm pretty sure individually at this point, and then it goes through a process with the association. But I will double check that.
Okay. If you'd share some more information with us?
Yes.
That'd be great.
Will.
Thank
I'll send you
Commissioner Wilson.
I'll send an email.
Okay, thank you. Any other board updates? The Chamber and Economic Development Coalition met last week. There's always a lot of crossover between those two meetings on Thursday and Friday morning. We did have a public policy update, and the Chamber continues to support many of the areas that are important to us. And one of those does include supporting our work around affordable housing. The second issue to update you all on is the EDC is looking to relaunch Accelerate Buncombe, which is a credential program for education and economic mobility that we helped start funding during COVID. And so that was really successful. They are working on a grant to bring that program back, which is really exciting. They do continue to work to recruit new industry. They're in Chicago right now working with site selectors to hopefully bring new industry or expanded industry to Buncombe County. And lastly, the annual meeting for the Chamber and EDC is next Wednesday, June 10th. If you haven't responded and want to attend, please let Sarah know. And to those commissioners who are able to attend Advocacy Days in Raleigh next week, we appreciate you working on behalf of Buncombe County. This is not a board and commission update, but I came across some really, I thought, exciting news for Buncombe County over the weekend. We just had 2 students from Buncombe County graduate the United States Air Force Academy over the weekend. Jake Miller is a graduate of Veritas, and he graduated first in the class at USAFA. Gracelyn Olinger, a Reynolds graduate, graduated 5th in the class, and they have both commissioned as second lieutenants in the Air Force. And very rare to have 2 students attending one of the military academies at the same time here locally, but to have them graduating 1st and 5th in their class, felt like that was worthy of us congratulating them on that achievement and for serving our country as second lieutenants in the Air Force. So I want to pass on our congratulations to those really, really incredible students. Is there anything else from anyone? All right. If not, our next briefing and regular meeting will be on June 16th at 2026, with the briefing starting at 3 p.m. downstairs. Our regular meeting is back up here at 5 p.m. Kurt, do we have any additional closed sessions? Just the one this evening. All right. All right, thank you all for sticking with us this long. And commissioners, again, thank you for your hard work over the last 7 months on the budget. Really appreciate each of you and your commitment to public service and serving the residents of Buncombe County. Do we have a motion to adjourn?
So moved.
Do we have a second? Second. All in favor?
Aye.
We are adjourned. Thank you.